Prevention. How you can prevent diseases. Prevention is often considered the supreme discipline in medicine. With it, you can prevent diseases from occurring in the first place. The advantages are obvious: it saves you and society time and money. First and foremost, however, it saves you yourself the discomfort of the disease that would have developed without prevention. There are different types of prevention. Among them is a healthy lifestyle, which helps to reduce the risk of common diseases such as diabetes and cardiovascular diseases. But targeted early detection examinations also help to prevent at an early stage. Prevention at a glance. Prevention means preventing diseases from developing. Primary prevention, detecting them early and therefore being able to treat them well. Secondary prevention, or specifically avoiding relapses of a disease that has already broken out. Tertiary prevention. Regular exercise, restful sleep and a balanced diet are important for the prevention of cardiovascular diseases, diabetes and other chronic diseases. Obesity, smoking, alcohol and constant sitting increase the risk of becoming ill. Vaccinations provide preventive protection against infectious diseases. You can keep an eye on your health and take more targeted preventive measures by regularly having parameters such as blood pressure, blood sugar, cholesterol, blood lipids and blood levels of vitamins and minerals checked. Early detection examinations are recommended for the prevention of cancer, for example for breast cancer, colon cancer, skin cancer, prostate cancer and cervical cancer. What does prevention mean? Roughly speaking, prevention means preventing diseases. But there is more to the term. The German Federal Center for Health Education defines prevention as follows: prevention, or more precisely, disease prevention, refers to all measures that aim to avoid, reduce/mitigate or postpone health disorders. So prevention is primarily about three goals: preventing diseases from occurring in the first place or postponing them far into the future. To recognize diseases as early as possible so that they can be treated as well as possible. To influence the course of diseases in such a way that relapses or recurrences rarely occur. Which preventive measures make sense for you depends on your situation, your genetic predisposition, your gender, your age, and many other factors. Types of prevention. In the health system, a distinction is made between primary, secondary, and tertiary prevention. The point is at which point prevention starts, before a disease develops, in its early stages or when it has already broken out. Primary prevention, preventing diseases from developing in the first place. When healthy people take action before a disease even starts, we talk about primary prevention. In this way, you can specifically reduce the risk of common diseases that are related to lifestyle. These include type 2 diabetes and cardiovascular diseases. By adopting a healthy lifestyle, you can significantly reduce the risk of these and some other diseases. For example, getting enough sleep, eating a balanced diet and getting regular exercise can help prevent these diseases. Of course, there are also factors that are detrimental to prevention, such as smoking, alcohol, a lot of sugar in the diet and constant sitting. Vaccinations are also part of primary prevention. They train the immune system to recognize and fight certain pathogens, mostly viruses. This usually means that people do not become infected with the pathogens or that the infection is at least milder. How well this works depends on the pathogen and the vaccine. For example, if you are vaccinated against the measles virus, you will be immune for life. Because influenza viruses mutate constantly, new vaccines are needed every year. Secondary prevention, detecting diseases early. Secondary prevention is about intervening at an early stage of a disease, when there are often no symptoms yet. In this way, you can prevent symptoms and sequelae from developing. The challenge here is to detect the diseases at this stage, which is why secondary prevention in medicine revolves mainly around early detection examinations. Cancer. With such examinations, doctors should be able to detect skin cancer, bowel cancer, breast cancer and prostate cancer at an early stage, because cancers can usually be treated much better at an early stage and often even cured. According to the Robert Koch Institute, however, only 2/3 of women and less than half of men make use of the services offered by health insurance companies. Heart, circulation, and metabolism. The health insurance funds in Germany pay for early detection examinations for cardiovascular and kidney diseases and diabetes mellitus. For example, the long-term blood sugar HbA1c is measured to detect diabetes or prediabetes. Secondary prevention also includes when people with prediabetes change their lifestyle so that they do not develop diabetes for as long as possible, or when people with high blood pressure lower their blood pressure in a targeted way. Nutrient deficiencies. For nutritionists, it is also part of secondary prevention to regularly test groups at risk for certain nutrient deficiencies and to compensate for existing deficiencies. This applies, for example, to older people who have already suffered from vitamin B12 or iron deficiency and who have since kept an eye on their levels with blood tests. Tertiary prevention, improving the course of diseases. If a disease has already broken out, it is often necessary to influence its course in such a way that it is as mild as possible. In many cases, the aim is to prevent relapses and exacerbations. Measures aimed at this are called tertiary prevention. For example, there are medications or behaviors that help migraine sufferers reduce the frequency of migraine attacks. Diabetics monitor and control their blood sugar levels to improve the course of diabetes. Rehabilitation after serious illnesses such as strokes or heart attacks is also part of tertiary prevention. What prevention measures are there? There are preventive measures that you can take together with your doctor. But you can also take many measures yourself. After all, a healthy lifestyle plays a major role in preventing certain diseases. Early detection and checkups. Doctors and health insurance companies support you with examinations that can help you detect diseases and problems early. Talk to your doctor about these measures if they are relevant to you. In Germany, health insurance companies cover these preventive measures, among others. General health checkups from the age of 35, including physical examination, cholesterol, blood sugar, urine test, blood pressure. Early detection of skin cancer, from the age of 35, every 2 years. Early detection of bowel cancer, risk from age 50, every 1 to 2 years, from age 55, also 2 colonoscopies every 10 years. Early detection of breast cancer, women from 30 years of age, every 2 years. Screening for cervical cancer, women aged 20 and over, annually. Screening for prostate cancer, men aged 45 and over, annually. Prevention through lifestyle and habits. Diet, sleep, exercise and the balance between stress and relaxation play an important role in the development of diseases. The typical recommendations for a healthy lifestyle also help you with prevention. Get enough sleep. Eat healthy. Regular exercise and sport. Maintain a healthy weight. Avoid chronic stress. Do not smoke and consume little alcohol. Have safe sex to prevent STIs. Much of this list is easier said than done. Habits around diet, sleep, exercise and occupation often run deep and are difficult to change. Don't try to overturn everything at once if you want to live healthier. Even if you gradually change small things that you implement permanently in return, you will contribute to prevention. Keep an eye on your own values. We can measure many things that happen in the human body. Measured values help you to find out in which areas it would be particularly useful to do something. This way you know which of your habits you should change first or which diseases you should treat early with the help of your doctor. Examples of parameters you can keep an eye on. Blood pressure. Blood sugar. Cholesterol and other blood fats, for example omega-3 fatty acids. Nutrients, for example calcium, iron, vitamin D, vitamin B12. Asking the right questions will also help you find the right prevention lever for you. For example, researchers at the Harvard T.H. Chan School of Health have developed the Heart Health Score to help doctors better assess the risk of their patients, and studies show that the score is good for assessing the risk of cardiovascular disease. You can go through the questionnaire yourself on the website of the Harvard T.H. Chan School for Public Health. With the German Heart Foundation's heart attack risk test, you can get an initial assessment of your risk in German in an online questionnaire. Prevention that matches your genes. Everyone has different genetic predispositions that make them more or less likely to develop certain diseases. Why is it useful to know your genetic predispositions? Well, if you know more about your individual risks, you can also take more targeted preventive measures. Consider whether close family members have had a particular disease. For example, if bowel cancer is common in your family, it may make sense to start screening earlier than planned, in consultation with your doctor. If heart attacks or strokes are common in your family, it is worth paying attention to blood pressure and blood lipids and targeting the risk factors.
In the meantime, there are also DNA tests that detect certain variations in the genes. In this way, they are supposed to provide indications of certain predispositions and risks. Prevention and nutrition. Diet has a huge impact on our health. A large study that appeared in the journal The Lancet in 2019 looked at the question of what influence nutrition has on diseases. According to the scientists, around 11 million people worldwide die every year as a result of poor nutrition. According to the study, too much salt and too little fruit, nuts, and wholemeal products play a major role in this. The rough formula for a healthy diet is: eat lots of vegetables, fruit, legumes, and fatty sea fish twice a week. If you are vegetarian or vegan, you should include flax seeds, chia seeds, or oils derived from them in your daily diet. This will provide your body with valuable omega-3 fatty acids. It is also best to choose whole grain products, for example bread, pasta, and rice. Whole grains do not raise blood sugar as much, contain a lot of fiber, and keep you full for a long time. Other foods are said to increase the risk of disease if you eat them frequently. These include red meat, sausage, sweets, dairy products, and fried foods. The worst foods for your health are high levels of sugar, saturated fats, and trans fats. Good to know, many nutritionists recommend the Mediterranean diet. This means a permanent diet with typical Mediterranean cuisine, lots of fruit, vegetables, legumes, nuts and seeds, fish and olive oil. Meat, eggs and dairy products are only eaten in moderation. Preventing nutrient deficiencies. Nutrient deficiencies can also be detrimental to health and increase the risk of disease. Certain diets, lifestyle factors and even intestinal diseases can contribute to people not getting enough of certain nutrients. You can get tested to see how well you are supplied with important vitamins, minerals, and blood lipids. You can then counteract low values, for example, by adjusting your diet and lifestyle or by taking dietary supplements. Here are some examples of how nutrients can contribute to prevention. Vitamin D acts like a hormone and has many functions in the body. Scientists are conducting many studies to find out how a vitamin D deficiency is linked to various diseases. One thing is clear: the body needs enough vitamin D and calcium to prevent osteoporosis and other damage to the bones. Omega-3 fatty acids are mainly found in fatty sea fish. In the body, they have an anti-inflammatory effect and dilate the blood vessels. A healthy ratio of omega-6 fatty acids to omega-3 fatty acids can therefore possibly help prevent cardiovascular disease. Vitamin B12 is a critical nutrient for people on a vegan diet. Adequate levels of vitamin B12 are important to prevent anemia and damage to the nerves. Iron is important for blood formation, and iron deficiency also leads to anemia. Women have a higher need because they lose a lot of iron through menstruation. Thank you for watching and have a look on your health.